as the world scrambles to prevent the spread of Mpox. SADC Health Ministers want to prioritize the development and implementation of multi-sectoral interventions to coordinate a regional response. The World Health Organization and the Africa Centers for Disease Control recently declared Mpox as a public health emergency of international concern and a public health emergency of continental security, respectively.
Since we have now the complete information, the EUL can be ready in the next 2 weeks, because it's already a week now since we have received the complete information. So, but still, we don't need to wait, until 2 weeks before we proceed with procurements, and that's why Gavi and UNICEF are proceeding with procurements side by side with the process of the EUL. So I think that has to be clear. And then on the vaccines, some of the vaccines, as Tim said, will arrive in the next few days in the DRC.
Authorities in South Africa remain on high alert, and some cases have been reported. Pretoria says countries must work together to fast-track approval of Mpox vaccines and treatment.
This is now a sexually transmitted infection, and we have seen how sexually transmitted infections can spread in Africa. We don't need to look very far. Look to our own country and see how a sexually transmitted virus can spread. So its potential to spread is there. What we need to do is to try and take all our concerted measures to prevent that from happening. So we need to act now to prevent the worst case scenario.
Scientists are also studying the new Mpox strain that has spread from the Democratic Republic of Congo. They say the virus is changing faster than expected. The DRC has had more than 18,000 suspected Mpox cases and less than 500 fatalities.
In DRC's South Kivu province, one of the regions hardest hit by Mpox, at least 42 suspected cases have been identified among the refugee population. Confirmed and suspected cases have also been reported in surrounding countries in Republic of Congo, as well as in Rwanda.
The Africa Centers for Disease Control and Prevention has been granted $10.43 million in emergency funding from the African Union for its Mpox response, and it says it will need 10 million doses of vaccines. Khayelihle Khumalo, SABC News, Johannesburg.